everyone. It's nice to meet you. My name is Dr. Saloni Shirke. I'm a graduate of the Caribbean Medical University School of Medicine, and I'll be presenting this case with my colleague here, Dr. Austin Ciccati, who will be introducing himself.
Hello, I'm Dr. Austin Ciccati. I'm currently a PGY2 in the Family Medicine program at Mercy in Fort Smith, Arkansas. So the case we'll be presenting is a rare case of acute lingual tonsillitis with COVID-19 infection. We'll start with a brief introduction here. So lingual tonsillitis is a rare cause of acute pharyngitis and commonly seen in patients with a history of adenoidectomy and palatine tonsillectomy. Due to the close proximity of the linguals with the epiglottis, symptoms often mimic epiglottitis. So we'll jump into our case here. We have a 19-year-old female with a history of adenotonsillectomy. She presented with fever, sore throat, neck pain, dysphagia, and drooling. 2 days prior to this presentation, she had tested positive for COVID-19. On physical exam, the oral exam showed cobblestoning of the hypopharynx with posterior oropharyngeal erythema and exudate. Subsequently, a CT scan of the neck with contrast was performed. This demonstrated inflammation of the lingual tonsils at the base of the epiglottis, thickening of the aryepiglottic folds, edematous pre-epiglottic space, and enlarged jugulo-digastric lymph nodes. We included a picture of the CT scan in figure 1. You can see that kind of area with the yellow circle. That would be where the lingual tonsils are located, and that just appears edematous on the CT scan. So due to this patient's imaging findings as well as her presentation, she was suspected of having early epiglottitis. So a flexible nasopharyngolaryngoscopy was performed. This showed a normal epiglottis, but inflammation and hypertrophy of the lingual tonsils with pustules extending into the aryepiglottic folds. This patient was started on IV ampicillin and dexamethasone and had significant symptomatic improvement within the first 24 hours.
So the lingual tonsils are lymphoid tissues that are located at the base of the tongue, and they're anterior to the epiglottis. They form the inferior aspect of the Waldeyr's ring, and they can be seen in the image on the left there. Similar to patients with palatine tonsils, they are prone to infections, malignancies, abscesses, ulcers, and varices. While 50% of adult cases are attributed to rhinoviruses and coronaviruses, this is probably the first known case reporting COVID-19 as an etiology of lingual tonsillitis. So patients with acute infectious lingual tonsillitis will present with fever and a wide range of aerodigestive symptoms, which are highlighted in table 1 there. And they can include sore throat, neck pain at the level of the hyoid bone, cough, dysphagia, dinophagia, a globus sensation, sialuria, altered phonation, referred otalgia, or in very severe cases, you can have airway stenosis. Clinical manifestations can mimic fatal illnesses. So in those cases, peritonsillar abscesses, epiglottitis, foreign body ingestion, and malignancy should be excluded. Radiographic findings demonstrate associated inflammatory changes of the epiglottis and supraglottis because these structures are so in close proximity. So usually a diagnosis of epiglottitis may be ruled in by mistake. So in suspected epiglottitis, it should be noted that direct laryngoscopy should be avoided. Instead, we need to do an indirect laryngoscopy, which can be a useful diagnostic tool in ruling out epiglottitis and ruling in lingual tonsillitis. So although it is extremely rare for lingual tonsillitis to lead to complications, we can have abscess formation or extension into the epiglottis and airway obstruction. However, with analgesics, antipyretics, corticosteroids, and antibiotics, you will have rapid symptomatic resolution. So in conclusion, lingual tonsillitis is rare and it's often mistaken for epiglottitis. While epiglottitis is associated with a high risk of airway compromise, the prognosis of lingual tonsillitis is favorable with the appropriate treatment. So establishing the correct diagnosis helps guide patient-centered care and reduces hospital costs. Thank you very much. We have our references listed at the bottom there, and we're happy to answer any questions.
Thank you very much, Doctor. It was really, it's an atypical presentation again, so very interesting to see. I'm curious if if the patient, I know that they tested positive for COVID-19, was there a more traditional, I guess, presentation of symptoms prior to the development of this tonsillitis, or was this the unique presentation of COVID-19?
So this was the unique presentation. The patient presented with the sore throat, the neck pain, and then by the time we saw her, she was noted to have some drooling. She was having a lot of difficulty swallowing. She was tested for like RSV, flu, strep. All of those were negative, and COVID was the only thing that we found.